When a patient walks into a clinic with chest pain, a cardiologist orders an EKG or an echocardiogram to examine the physical organ directly. Clinical psychiatry lacks an equivalent biological test for schizophrenia. Instead, doctors must navigate the DSM-5, relying on patient self-reports, family history, and subjective behavioral observations. This process is complicated by the fact that schizophrenia symptoms frequently overlap with other conditions, such as bipolar I disorder, making it difficult to distinguish between them through observation alone. These subjective hurdles create a massive gap in care. While a physical ailment might be diagnosed in a single day, a psychiatric patient often waits between 1 and 3 years for a definitive conclusion. To bridge this gap, academic consortia and biotechnology companies are developing objective biological tools to move psychiatry toward a precision medicine model. Researchers are working to compress this multi-year timeline into a matter of days, giving patients and clinicians a clear, data-driven path to treatment. We now know that schizophrenia is a systemic disorder that leaves measurable molecular footprints in the peripheral nervous system and the bloodstream. Laguna Diagnostics is utilizing these markers by analyzing specific mRNA gene expression panels found in standard venous blood samples. This transcriptomic data is processed through an algorithm that differentiates schizophrenia from bipolar disorder with near-perfect accuracy. This ability to deliver an objective probability score in days rather than years earned the technology an FDA breakthrough device designation. Similarly, MindX Sciences uses dynamic RNA sequencing to track psychosis as a fluctuating biological state that changes based on disease severity. These blood-based tools provide a scalable, minimally invasive way to bypass years of clinical observation with a single draw. Beyond systemic markers, researchers are also looking at the physical hardware of the brain. Historically, structural changes could only be verified through post-mortem tissue analysis. A breakthrough in PET imaging now allows clinicians to measure synaptic density loss in the living human brain for the first time. Functional MRI reveals that schizophrenia involves distributed network dysregulation, where communication is disrupted across multiple brain regions. The Functional Striatal Abnormality Index, or FSA, quantifies these anomalies by mapping individual connectivity patterns in the striatum. These baseline scores do more than identify the disorder. They accurately predict how an individual will respond to a 6-week course of antipsychotic treatment. Neuroimaging is transforming psychiatric theory into physical evidence, allowing clinicians to see the disease and predict its trajectory. While scans show the structure, EEG allows clinicians to measure the brain's real-time processing speed and coordination. This modality captures the mismatch negativity wave, which reveals microscopic deficits in how the brain automatically detects changes in sound. Because this data is too complex for manual review, researchers use machine learning to fuse high-speed EEG data with high-resolution fMRI maps. Deep learning architectures, such as VGG16, use this multimodal fusion to classify schizophrenia with exceptional accuracy. Artificial intelligence serves as the final engine, identifying diagnostic patterns in neurological data that would otherwise remain hidden. Standalone genetic tests, such as polygenic risk scores, currently lack the predictive power required for an individual clinical diagnosis. Targeted Mendelian panels remain useful, however, for ruling out rare genetic conditions that can mimic psychiatric symptoms. Modern psychiatric care integrates multi-omic blood panels, machine learning-driven connectomics, and passive EEG into a unified diagnostic ecosystem. This combination establishes objective criteria for the first time, optimizing both clinical trial design and long-term patient monitoring. For patients, this means bypassing the standard trial-and-error approach to medication, identifying the most effective treatment for their unique biology in weeks. By replacing subjective observation with multi-omic science, we can reduce the duration of untreated psychosis and change the trajectory of millions of lives.